Good morning, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So now we'll discuss about some common injuries in older athletes. So injuries, definitely, they are the six leading cause of death in older adults. Typically, it occurs from fall in a frail older individual, and most they are related to movement. And women 8 to 21%, men 9 to 95, 35%, they are related to sports activities. So basically, we can say that they are common in adults, older adults who participate in these activities because there is high demand of coordination, balance, reaction time, which are skill related components of fitness. So these include ball games, skiing, gymnastics. So falls, slip strains, they account for the major of the injuries. Then inflammatory overuse injuries are like muscle strain are common, especially to back and lower extremity. Like in case of strength or power athletes, they tend to have more injuries of upper extremity than endurance athletes. Knee, ankle, foot account for 39% of all the injuries. In case of endurance athletes, or we can say in power strength, there is more muscle tendon insertion injuries are there. There is a risk of spontaneous low energy tear to rotator cuff and Achilles tendon, patellar tendon, medial meniscus. Although not frequently seen, stress fracture of lower extremity have been found in runners and marchers, definitely. And also, no evidence is showing or supporting the high intensity, high level physical activity. Are they promoting the degenerative arthritis? So, trauma to hip, knee, ankle, prior surgery, the poor alignment, or if there is any inadequate strength, obesity, they can be correlated with development of OA. So it most commonly occur during competition for soccer, football, and recreational athletes. So we are having some list like tendinitis, patellofemoral pain, muscle strain, ligament strain, plantar fasciitis, metatarsalgia, meniscal injuries, degenerative disc, bursitis, sorator, we can say rotator cuff tear, and subacromial impingement, Achilles tendon tear. And how we can diagnose and manage it. So usually these injuries lead to further osteoarthritis of knee, hip, wrist, thumb, as well as bursitis of hip and back and Achilles, or there could be rotator cuff tendinitis that can also occur. So usually good history taking and performing adequate examination, and usually most of elderly athletes do not report injuries immediately. They wait and then see approach. Means the acute injury must be treated as if it were chronic. They have to, and definitely it begins with the diagnosis, management, and the entire region in question. Like one should see, and is there any kind of muscle imbalance? Is the structural malalignment need to be evaluated? Then next we are having, we can also control the inflammation if we provide a proper rest for healing repair. It can also promote healing through site specific rehabilitation or cardiovascular training. Or definitely, if we want to achieve a pain free range of motion, then strength and endurance test return to pre-injury state. We can also counsel them about not taking these drugs, or so control their views by educating the older athlete, which is not always better that overtraining precipitates fatigue. So they should understand. And definitely, if we are giving any kind of medication, then give with the slow and then high. Use 1 by 3 to 1 by 2 recommend dose, always starting as is, reviewing all the functions for potential drug interaction. Aerobic exercises, they are in the form of mm, they are in the form of walking from a more moderate to vigorous pace, is very attainable for most of the committee dwelling elders if the barriers of environment safety are taken into account, and they should be formed on the most of the days of the week with the goal of achieving 30 minutes of moderate to vigorous intensity. It can also be achieved by splitting 30-minute goal 2 to 3 sessions. And we should discuss the warm up and worn down as part of the prescription. Definitely, resistance training is necessary to counter the muscle trophy of aging and disuse. Current research indicates that healthy persons of all ages, even those with chronic disease, even a single set of 15 repetitions performed minimum of 2 days per week can help develop and maintain the muscle mass, endurance, and strength. Also, the workout session should include 8 to 10 different exercises targeting the lower back, abdomen, leg extensor, flexor, chest, biceps, and calf and hip adductors, abductors. To minimize the possibility of orthopedic risk, the exercise should start lower intensity, such as 10 repetitions with low weight, progress slowly. Thank you.